Refractory ceramic fiber awareness. Refractory ceramic fiber, or RCF, is a form of high-temperature insulation. It resembles cotton batting and can be found in multiple forms, including blanket, paper, rope, and modules. RCFs are amorphous man-made fibers produced from the melting of calcined kaolin clay, or a combination of alumina and silica. RHI Magnesita produces and distributes RCF under the brand name Pyrostop. When new, RCFs are a suspected carcinogen, though to date exposure to new RCF has not been conclusively proven to cause cancer. New RCFs still irritate the skin and respiratory tract if proper PPE measures are not followed. When exposed to high temperatures, RCFs undergo a structural change called devitrification. This is when the structure becomes crystallized and then can be easily fractured into smaller particles. Typically, the byproduct of devitrification is crystalline silica. Some forms of crystalline silica are carcinogens and can be hazardous through prolonged unprotected exposure. Because of this, extra care should be taken when handling used RCF material. In order to control the hazard posed by RCF, the controls we use include restricting access to the work area, minimizing exposure to those participating in RCF work, the use of personal protective equipment, decontamination procedures, proper waste disposal procedures, and emergency procedures. RHI supervision are responsible for restricting access to the work area. Whenever possible, all non-essential personnel will not be permitted to enter the area. Signage to be posted in areas where RCF work is ongoing, warning about the risk of RCF exposure. Workers requiring access are to be provided instruction on the specific RCF hazards and controls. Where possible, RHIM will work in cooperation with the client site to isolate areas where RCF installation or removal is taking place in order to minimize exposure. Hoarding the work area using scaffolding and tarps, or creating a barricade using flagging tape and tags or signage will isolate the work area. This will create a controlled zone where workers requiring entry will be expected to wear their prescribed PPE and follow all decontamination procedures. Apart from site standard PPE, the following PPE is required when working with RCF. Respiratory protection equipment consisting of minimum half-face respirator and P100 filters. Upgrading to a full-face respirator may be required depending on the type of work, volume of material, and client requirements. All workers are to be trained on the limitations, use, and care of respiratory protective equipment and undergo a fit test prior to work. Disposable coveralls are required to protect the worker from contamination. In some cases, it may be required to wear 2 pairs of disposable coveralls to further limit clothing contamination. Refer to the job-specific JSA for more details. Nitrile gloves are also recommended to prevent skin irritation when handling RCF. Workers who have been exposed to RCFs will be required to decontaminate prior to removing their respiratory protective equipment. A designated decontamination facility or area will be created to facilitate the safe and effective removal of RCF-contaminated PPE or equipment. The facility or area is to be enclosed or in an isolated area and will be equipped with the following items as required to ensure minimal outside exposure to RCF. A HEPA-filtered negative air mover, a HEPA-filtered vacuum, a garbage can and moist towelettes, or a bucket of water and rags. Typically, decontamination procedures are as follows. The worker enters the area wearing all PPE. The worker removes their coveralls and nitrile gloves and places them in the garbage. Worker uses the vacuum, towelettes, or rags to clean their hard hat and other items. The worker can then exit the facility and remove or bag their respirator for cleaning. All items should be disposed of in 6mm poly bags. Refer to the JSA for a detailed decontamination procedure. All waste RCF material is to be double bagged using supplied polyethylene bags. Bags of waste material are to be tagged as RCF. Waste is to be disposed of in designated waste containers supplied by the client. Waste from decontamination is to be treated as waste RCF. In the event of an emergency, those exposed to RCF material are to immediately head to the designated muster location and are not to stop at the decontamination facility. When at the muster point, workers wearing contaminated PPE are to distance themselves from other unprotected workers. When declared safe to do so, they can then head to the decontamination facility. Client-provided rescue services should be informed of the refractory ceramic fiber hazard if they might be required to enter the vessel for confined space or high-angle rescue. If possible, RHIM supervision should request an alternative muster location for RHIM personnel exposed to RCF to minimize exposure to others.